Good afternoon, everyone. Thank you very much for joining us here in the Green Zone. Proud to be part of the SADAR group this afternoon and talk about a clean bill of health and the opportunities for removing carbon from healthcare and delivering a clean bill of health for patients around the world. Now, I'm Kathy Wardle. I am the Regional Director of Regenerative Design for Perkins & Will. I'm based out of Vancouver, Canada, and with me today, we have a number of great individuals who've joined us to talk about the solutions that everyone's working on from around the world. Here we have Zaina Tawakal from Zaina is the Executive Director and oversees the operations for the Magdi Maku Healthcare Foundation. We have Simon McWhitter, the Deputy Chief of the UK Green Building Council, all the way from the UK. We have Asif Din, a colleague of mine, Director of Regenerative Design from our London studio at Perkins & Will. And then Andrew Castle, Director of Health for Curry & Brown for the Saudi Arabia region. Welcome, everyone. And before we get started on our discussion, I do want to frame the issue and kind of the issue and the challenge, but also the opportunities that we have at hand. So we know globally that the healthcare sector accounts for about 4% of our global GHG emissions. What does that mean? That's equivalent to about 514 coal-fired plants. Or alternatively, it's equivalent to about, if we translated that into national emitters, the healthcare sector would be about the 5th largest emitter globally. So that's quite significant when you think about the emissions associated with one sector. And Healthcare Without Harm likes to say that on principle, the healthcare sector has a responsibility of doing no harm. And so when we think about doing no harm, we should do no harm not only to our patients, but also to the planet. And I think really the opportunity is looking at planetary health and what the healthcare sector can do. When you break down those emissions, that 4% globally, 17% of the emissions are associated with Scope 1 emissions, 12% are Scope 2 emissions, and then over 70%, or about 70%, are associated with Scope 3 emissions. So you can see kind of the magnitude of the issue that we are dealing with. Most of us here work in the building sector. We're delivering our services to design, whether it's architecture or engineering services, or we're advocating for policy change in the sector. And so, I think how do we tackle each of these scopes will be something that our panelists will talk about in the coming minutes. So when we think about decarbonization in the sector, it really requires a careful balancing of care and resilience to deliver reliable and acute health services to communities around the world. One of the biggest challenges that we face in delivering great health care is the continuity of operations under all circumstances. And when we're faced with a changing climate, we also have to think about how do we ensure that these facilities can be resilient and ensure kind of 24/7 care for the patients that they're delivering care for. So just to kind of frame what we do, this is the Spalding Hospital in Boston. It is a LEED Gold hospital that Perkins & Will designed, and it was really designed with resilience in mind. So understanding, how would the facility continue to operate under severe conditions of sea level rise. And so, careful consideration was given to the placement of mechanical systems in this hospital. The Leeds Hospital, which Asif has worked on, really shows in this schematic concept how the building works as an entire system to optimize, conserve energy, conserve water, and really help drive down emissions. And I'm going to let Asif kind of speak to some of the solutions that design team has been pursuing. This is another facility. It's the Lucille Packard Children's Hospital in Stanford in California, designed by Perkins & Will. And This is a LEED Platinum certified facility that worked really hard to reduce emissions. About 90% of emissions are reduced from this facility due to conservation measures, but also being linked to a cleaner grid, microgrid in the area. With Zaina on our panel today, really excited, and she's going to speak to the completion of the new Heart Center in Cairo in Egypt and their journey in delivering this LEED Gold facility. And DAR, our partners here, were kind of proud engineers who helped, worked with Zaina and her team in delivering this healthcare facility. And then finally, the Monk's Land replacement project designed by the Korean Brown team really looked at kind of a building retrofit and expansion opportunity and working with a client who's really interested in delivering kind of a net zero solution in the Scotland marketplace. So what does that mean? What does it mean for all of us in the healthcare setting while still being able to deliver on the program requirements and the 24/7 care requirements? So with that, what are the challenges and opportunities that you face as practitioners? Simon, what do you face from a policy standpoint and kind of guiding the conversation? And so our panel is going to kind of walk through opportunities around policy. What are the opportunities for existing building retrofits, upgrades from a healthcare perspective? What do we do when we go out to design new buildings? And then finally, what about user access? How do we deal with those Scope 3 emissions when we're designing new healthcare facilities around the world? So with that, I'm going to transition myself to sit with the panel and ask some series of questions. So bear with me for a second. All right. So thanks, everyone. Before we get started, perhaps we'll just kind of do a quick round robin. You can say your kind of role and your thoughts on. We can start with you, Zaina. In terms of your role in delivering healthcare and what kind of decarbonization or what you see as kind of the opportunities in your local marketplace.
First of all, thank you so much for having me here today. It's very interesting to be talking about how healthcare systems can actually work towards having strategic plans to help the environment. Like you said, there's a lot of the healthcare systems contribute to about 45% of carbon dioxide emissions, and it is important to see how we can contribute towards net carbon operations. There's a lot of thoughts of how, like you said, it's a 24/7 operating model, right? It's a very labor intensive and energy intensive, and there's a lot of strategies that needs to be put in place to be able to make people aware what's happening and how can we operate in a better energy efficient way. Also work with the government in trying to establish the policies on how to initiate such projects from the start, not only retrofit buildings that are already working in the healthcare system. So that's, I think, is very important. I think Egypt has started a little bit to work towards this, and there's a very, very long road, but we are starting to work towards a better healthcare system that is efficient and positively contributing to the environment.
Great. Simon, how about you? Do you want to just speak a little bit, some opening remarks, who you are and kind of the role you play in advocating for change?
Yeah, thanks, Kathy. So I'm Simon McGuire. I'm the Deputy Chief Exec of UK Green Building Council, and within that remit, I specifically focus on our policy and political work. I think you sort of name-checked the Hippocratic Oath in your opening remarks about the purpose of healthcare is first to do no harm, and I would say unfortunately in the UK our health estate does quite a lot of harm in and of itself. So we're not starting from a very good place there. It's a very complex arena to deal with in the UK, certainly. And therefore, we need a very complex response, and we don't get that very well from government. I'll come on to some of the upsides in a moment around that. And we're not very good at treating the healthcare sector in an efficient, responsive manner. We're not very good at treating the interface between the healthcare sector and wider society, how it interfaces into our housing sector, for instance, and how they play with each other. We're dealing with things at the moment on a UK basis in a very siloed manner on this, so we're looking at the healthcare sector as something to deal with rather than those intrinsic links that it has. And I think the thing that we're really behind the curve on that, not just in terms of dealing with our estate, is around really looking at preventative healthcare. You know, how are we mitigating the problems before they arise and dealing with it in that wider sense? I think if we look at 2050 and the challenge for the UK, something in the region of 70 to 80% of our health infrastructure has already been built. So we are dealing primarily with a retrofit and upgrade challenge over the next 25, 27 years. If we flip that, in Africa, across the continent, only 20% of the built infrastructure in 2050 has been built. So very much on the African continent, they're facing a new build challenge. How do they avoid embedding the problems of what we're doing? How do they avoid building the retrofits of the future? So I think my sort of, we're facing really different challenges, but actually everybody's dealing with different bits of a very much bigger puzzle. So how do we, through this engagement, look at what does the global knowledge exchange need to look like, where we're all sort of sharing that across that endeavour?
Some really great nuggets in there, Simon, that I think I'm going to come back to after the round of introductions. So, Asif.
Just following on from what Simon said, in matter of fact, we should actually look at healthcare as a social infrastructure. It is something that is a human right. It needs to be thought of effectively how it actually plugs into the larger system. In the UK, we have really quite big healthcare estates, and it's more of a campus solution than it is, a matter of fact, an individual building solution. Whenever we're looking at, saying, retrofitting a campus, we're looking at a range of different problems. We're looking at existing buildings and what they can actually be upgraded to. And whenever we're building a new building, we have to make sure that it's future-proofed in the sense that it can be upgraded in the future. We're not creating problems that we're going to actually then say, right, okay, well, there's no way that we can actually retrofit this for resilience, for its future life. One of the good things about the healthcare system, especially in the UK, is that effectively we do have a grid decarbonisation plan, which means that electrification will lead to decarbonisation. But we cannot overstrain the actual existing infrastructure that's already there. If we're going to do that in terms of a business as normal, we'd need to boost our grid by about 3 times. So, as a retrospect, anything that we actually build has to be roughly a third of the amount of energy that we build at the moment. So it's about all of that energy efficiency and looking at it as a complete system.
Great. Nat, Andrew, how about you?
Hi, thank you for the opportunity. I mean, I think from a Saudi perspective, there's sort of 3 points. One, it's obviously critical in the long run that we consider sustainability with the new infrastructure, rising temperatures and the environment in which the country, the local environment. But I think there's an enormous sustainability within Saudi. Energy is
It's not working? Okay.
I thought it was me. I thought it was me, but it was the microphone died. So there's an enormous range in approaches to sustainability within the kingdom at the moment. Ranging from 100% renewable energy with within the giga projects to more local construction where it's not necessarily a consideration. But I think the most important or critical thing within healthcare is there's an enormous opportunity within the kingdom. There's 100 new hospitals planned, 2,000 primary healthcare centres, and a requirement for a further 20,000 beds, which just presents a significant opportunity for sustainability to play a part.
Some great opening thoughts and remarks from everyone. Now, from the preamble, your opening thoughts, we understand that the healthcare market sector really is very energy intensive. And so, I guess I'm going to start with Simon. From a policy standpoint, can you speak to what you're seeing in the policy environment that is emerging as best practice to kind of help transform the sector? Because you talked about knowledge sharing. So, are there lessons learned that we can learn from the UK or other developed regions that can go to underdeveloped regions, or vice versa, from a policy point?
Yeah, no problem. So if I just firstly talk about the sort of macro position and policy in the UK and then speak specifically to the healthcare sector, we have a pretty piecemeal building strategy at a policy level, unfortunately, in the UK. And for anyone who keeps their finger on the pulse of what's happening there, I listened to the UK minister speak this morning, and it sounded as if they'd fixed the climate problem. But unfortunately, 6-8 weeks ago, they rolled back a load of really significant policies in the UK around electrification of transport, decarbonisation of the built environment through housing, and banning gas boilers. And unfortunately, we've got a general election in the horizon next year in the UK, and climate is increasingly being used as a wedge issue, and it's becoming quite polarised. We may well be seeing a change in government next year, and their policy space is more aligned to the sort of things that we would all be talking about in this arena. So there's not a lot of political leadership there at the moment in the built environment in the UK, but where we do see really good leadership is industry-led responses to the problems. So as UK Green Building Council, we convened about 100 of our industry members together 2 years ago and developed a whole life carbon roadmap for the UK. So that was about creating a common vision and a trajectory to a net zero carbon built environment for 2050. And it was really clear on the policy moves that needed to happen over the next 27 years to get there, and the industry actions that needed to happen. And what that now does is we've got a tool with which we can engage with our members, engage with government, and really hold their feet to the fire as to, well, you were supposed to do this by this time, you haven't, how are you going to make up that lost space? And that's been really powerful for us. We're actually just launching, while we're here at COP, the beginning of a process where we're mirroring that for climate adaptation and looking at how we embed resilience into the UK built environment over the same timeline. Another really good example of UK best practice where, again, industry has come together is around, we're developing a net zero carbon building standard. So all the major professional bodies and a lot of industry bodies, so from RIBA to the Chartered Surveyors, RICS and Letian, originally out of London, and UKGBC have come together to sort of try to address greenwashing and many other things by saying, actually, we will develop a set of metrics on each building typology which says this is what the net zero carbon version of that building type is, and then we all know we're running at the same place. And healthcare sector is one of the typologies that we're addressing through the standard. That will be out next year. So those are the sort of macro positions where we are seeing best practice led by industry, I would say. One specific one in the healthcare sector, which in fairness is largely driven by government as well, is around the NHS net zero standard. So Asif might be able to talk more eloquently about it, but it's a very granular standard, and it's really looking at the carbon impact per patient outcome. So it's moving away from an area-based metric of how we look at the carbon intensity, what we're doing, and sort of try to make a much more whole systems approach at reducing carbon intensity but delivering better patient outcomes at the same time. They're also taking a retrofit first assumption through the NHS net zero standards, so really trying to upgrade and improve the built estate we've got, taking a whole life carbon, embodied carbon view of that. And it's also putting a real focus on adaptability and flexibility of building use over time. And there's an inherent assumption within that in many cases that's going to see an upfront carbon hit on the buildings, but in terms of long-term value and long-term usability and the flexibility that will be embedded within that, then it will hopefully deliver a much better outcome. It was consulted and developed over the last few years. I think it's been enforced formally for 9 months now. So we haven't actually seen buildings come through that. So, we've got a couple of years before we see proof of life from that. But that is a really good example where if it's delivered as it's conceived, that will begin to set a much better standard in the public NHS estate in the UK.
Yeah. I think one takeaway, just kind of building upon your thought there, we were in the innovation zone or the Climate Action Innovation Center this morning, and one of the gentlemen speaking in a kind of fireside chat talked about the importance of stability of policy for businesses and organizations trying to bring about change, because change doesn't happen overnight. You don't build a project within 1 year. It may take 10 years to build a new healthcare facility, design, construct, commission your facilities. And I know in British Columbia, in Canada, we have the Energy Step Code that is providing a charted pathway for municipalities to adopt progressively better performing code standards over time. For industry, that gives us a sense of where we need to go and how quickly we need to change, how the supply chain also needs to change alongside code. And so I think for an industry like healthcare, where change takes a while, if we're honest with ourselves in terms of how long it takes to build, construct, design, and construct a facility, I think stability around policy directive is really important. So I just wanted to kind of build upon that. Now, from a project standpoint, Asif, maybe you could talk about what you're seeing as emerging kind of best practices in terms of specifically decarbonization solutions.
Ooh, right. Okay. Well, in terms
You
of
could draw upon the Leeds building. Or
yeah. I will do. And also the NHS standard that has already been mentioned. The way that that's actually done, that is more done on an area-by-area basis. So high technological areas will also have a higher carbon input rather than low technological areas. Now, there's 3 sorts of technological areas. Each one has its own energy requirement. And then from that, you're benchmarking your mix of your building according to those little Lego blocks, essentially. And what you're doing from there is making sure that you drive that down as much as you can. Then the flip side of that is, how do you actually deliver that in terms of construction? So, first of all, you're taking the energy loads down in terms of its operation. And then you're thinking about, well, what am I going to make it out of? What are the technical aspects within that building that it needs to address? Things like vibration resistance, acoustics, stability, all of those sorts of things. And as an industry, we are very, very good at providing things that are reasonably over-engineered, because we have large consultant teams, and everybody puts their safety margin on. All the way down the line, we put on 5-10%, saying, right, okay, we're going to design it for this, but we're going to put that on. Design it for this, put it. That throughout the project actually means that our buildings have a lot of scope to be a lot more efficient. Now, that's not to say that effectively we're not thinking about resilience, because we also have to design for that future climate. So we're looking 100 years ahead, and we're actually designing for that future climate for those buildings to actually work. But even on that basis, there is at least 20 to 30% that we can actually shave off in terms of the amount of carbon, because, as a matter of fact, we're not dealing with those aspects that are just put in for that safety margin to make sure that, sort of like in a risk-averse environment of the building industry, that nobody's going to get sued.
Thanks, Asif. Now, Andrew, you talked about, in our kind of our prep session, that you've just done some planning work to kind of understand how do you bring 150 new kind of healthcare facilities online in Saudi Arabia. What do you think the opportunity is for kind of ensuring that you bring, as you design 150 new facilities, that you make them the best that they can in terms of meeting some of these larger climate commitments?
So I think KSA has invested an enormous amount of time in determining what the future models of care look like. But you have to provide facilities that are flexible enough to adapt to changes in the way that medicine is provided. So it's a natural move to move care out of hospital. It's like diagnostic and treatment centres, but things like the move for apps for pacemaker patients, where you no longer need to bring people in for follow-up outpatients because you only get notified as they deteriorate remotely, removes the need to provide a given level of outpatient facilities. And we need to consider this. We need to move back from starting with the building and what we're going to put in it from a clinical perspective to what's the actual need and what's the best way of providing that within the community. And that is going to change with the use of digitization, telemedicine, virtual wards, the fact that you can do remote monitoring. And so the requirements for the future infrastructure will change, and they'll change over the design period and the construction period of a new facility. So those are the opportunities, and we need to build spaces that are flexible enough to provide care as it changes over time.
Yeah, and this kind of change in maybe the healthcare model can also help tackle that 70% of your scope 3 emissions, because part of your scope 3 emissions with the healthcare sector is about the patient traveling to and from the location where health is being provided, in addition to pharmaceuticals and others being produced to support the health that we need. So,
Well, I mean, I think that's certainly we've seen that in Northeast London, where physicians obviously like patients to come to them. They like them to come to them for surgery, for chemotherapy, for radiotherapy, for services to be centralized, but actually one that's possibly not best for the patient. But the fact is that a number of these services can be provided within the community, closer to the patient's home, and there are other solutions other than a built environment solution to providing care.
great. And then Zaina, now with your new Heart Foundation or Center online, maybe you can speak to some of the kind of best practices that your team was able to implement and integrate into your new facility.
Great. I do support a lot of what was said about the change in the healthcare structure in the future. With the digitization that's happening, primary care is going to change the way patients access care. But it's also important to think of when, as a healthcare facility, your most important thing is patients' welfare. And there's no point in trying to promote patients' health and not have a good and environmentally responsible building, right? So it's all part of the care for the patient. And this is why we at Magdi Acute Foundation, and you also said it's a very long process. We did that 8 years ago when we started planning on expanding our services in Egypt and wanted to plan the new heart center in Cairo. It was put in our minds that we are responsible towards we are a responsible organization toward the environment, and we want to build a sustainably energy efficient building. So from the design, when this was put in place, we adopted a sustainable strategy with DOR and all our designers, and we had a wide range of energy savings models and strategies to reduce our consumption. And we're able, with all the strategies that and systems that are put in place, with the data that we have, we will be able to reduce our carbon footprint by 16% to the business as usual. Well, some is here who helped a lot with the project. So that is our commitment towards the environment and what we feel needs to be done. There's also a lot of the procurement strategies that we had with the low-emitting materials that we used that fits within the Egyptian weather and the conditions and everything. And I believe that's for the new building, right? But we have an old building that we wanted to check how can we retrofit it in order to also become more energy efficient. So we looked at all the areas that we're trying to do. Solar panels on the roof to try and reduce our energy consumption. Solar heaters to try and reduce our diesel consumption for the hot water. Waste management systems, which are very important in the healthcare system. So all of these things would help in reducing operationally our impact and the emissions rates.
Now, Zaina, you touch upon the existing buildings and kind of the opportunities for retrofits. Simon, you mentioned that for the UK market specifically, it's largely kind of existing buildings that you're having to tackle. What are you seeing? What movement do you see in terms of retrofitting buildings? I'm kind of deviating from the script here a little. Sorry.
No, that's quite all right. So, like I say, there are things in process in the UK which will drive much better quality around that retrofit. The presumption of retrofit under the net zero standard is a really good example. But I don't mean to keep coming across as critical of UK government approach in this stuff, but it's a really good example where we have really good best practice policy in certain areas, but then a lack of coordinated, joined up thinking. So, you know, if I think of the housing sector at the moment, where we don't even have a national retrofit strategy. I go back to the 80% of those homes will still be here in 2050. We don't have a coordinated plan to how to fix those. At the moment, the UK NHS gets hit with about £2.5 billion a year in costs that are directly related to people living in substandard homes around excess cold, excess heat, excess damp. So, you know, we're not taking that integrated retrofit thinking into housing, which will alleviate a lot of the concerns over, you know, the sort of pressure on the healthcare system at the front end. And I think just policy more generally on that point, you know, you touched on the sort of long-term clarity point that comes through very clearly. And this is a drum that we bang all the time, that, you know, all industry and the investment sector specifically want to understand that long-term clarity they can get. That's what gives the comfort and confidence to invest for the long term into this space. And we don't get that. So I think, you know, one of the biggest concerns for me around retrofit policy, for instance, in the UK across all building typologies is we've seen stop-start regulation, we've seen cliff edge funding around the retrofit agenda, and that's just very, very damaging. You know, we keep seeing the skills base and the supply chain developing and then retarding again when that funding falls away. And I think, you know, we see things like the NHS net zero standard coming through, think, bloody hell, that's great, that's going to do a really good thing for our health estate. And then actually thinking, how safe is that when we look at a 4-year electoral cycle and we know that they've all been rolled back 6 weeks ago. So even that really good policy positioning on the back of which organizations will now invest, how comfortable can we be with that? So that, you know, that's unfortunately that retrofit space, good pockets of activity, discomfort around the policy envelope that it sits within.
So maybe I'll pass this over to Asif. You know, I think we've all made clear that hospitals are one of our kind of critical pieces of infrastructure. And when we think about, you know, all the environments or countries or kind of local geographies in which we're situated in across the globe, we all face different resilience challenges. So, you know, from a healthcare standpoint, what do you see are some of the key solutions that we need to think about as we deliver resilient healthcare facilities? And what are you seeing in the design process, Asif?
It's crystal ball gazing, unfortunately, and it's sort of, you're designing for now, but you need to design for that adaptability for later. Now, you know, sort of like in terms of what we've done, say, with Moorfields Eye Hospital, it means that effectively that building can be converted to something else. It's a kit of parts that can be actually taken apart because, as everybody's been saying, you know, sort of like healthcare now is not going to be healthcare in the future. We are trying to decentralize healthcare in that sort of sense because it affects so many other things. If we retrofit all of our homes, no damp issues, you know, sort of like respiratory issues, remote monitoring. And sort of like recently I had a blood test, and you know, sort of like before, it was sort of like you went into a doctor's surgery, you got blood taken, call up 2 weeks later once you get it back from the lab. It all happened on the spot. A little machine in the corner did it all. Now that was just like, wow, that's amazing. But you know, that's only over a couple of years. We're designing long-term assets, 100 years plus, that need to be able to deal with that adaptability and change. So our hospitals may become housing in the future, may become hotels, but we've got to actually design that flexibility in now.
And what about thinking about the grid that they're connected to, and how do we ensure kind of a reliable but decarbonized energy source for our healthcare facilities?
As I said before, effectively we got to reduce the amount of loads first of all. That's minimum as we can. Really take those down, because as soon as you take those down, a range of other options come into play. Electrification will only work effectively if we actually take those down, but we're also dealing on a campus-based scenario. So it's not only thinking about the hospital as one jigsaw piece, we're also thinking about that jigsaw piece in the wider context of the city. Now, the sort of like, sometimes, in terms of, the Swedish hospital, for example, that in that case, the healthcare facility becomes the energy generator. It produces an excess amount of heat, then that can be distributed to the rest of the city. But equally, if you have a data center right next door to the hospital, then that becomes a heat source, and then the hospital can use that as a heat source. So it's about using other facilities in the local area to create that resiliency, but also create that correct mix of actually load sharing across a wider scenario to make it more resilient.
I love that approach about kind of taking a systems thinking approach, understanding kind of the ecosystem of, I don't know, programs and uses, understanding what your neighbors are, and, you know, opportunities for energy sharing. I think that is part of how we become more energy smart in how we use energy. Because also, we heard this morning that I think 65% of the energy that is produced and consumed is actually wasted. So how can we actually be smarter about the kilowatt hours of energy that we use? And, you know, the smarter we are, the less we use ultimately. So now, in this conversation, there's always going to be barriers. And I'd like to understand maybe first from Andrew, you know, working in Saudi, what do you feel are some kind of barriers to bringing about this change? Because you're in an expansion market. And so what barriers do you see to being able to bring about this change?
I mean, I think the first barrier from a built environment perspective is a focus on cost primarily as a priority over healthcare planning or the cost of ownership over the life of the asset. And we're also in we're in a market where people prefer to visit a hospital. I mean, the starting point is you go to hospital for treatment, you go to hospital to see the doctor, and it requires a behavioural change. And so the barriers are sort of the expectations of the consumer of healthcare, as well as the motivation of developers or healthcare providers within the market. But that provides an opportunity for a new way of looking at it. I mean, you will own the asset for decades. You need to think differently about how you provide healthcare. We're moving to an insurance-based system, and if the cost of ownership rises at a faster rate than the revenues from the provision of healthcare in the insurance system, it will change people's focus in terms of how they look at developing new facilities.
Asif, we can kind of work our way back this way.
Oh, right. Okay. There are too many standards out there. And they are very, very prescriptive in the way that they actually operate. They're not performance-based. They are, thou shalt do this. And in matter of fact, because it's such a complicated system and you have so many stakeholders, the thou shalt do this actually overrides pretty much everything else. And it doesn't look to the future in that sort of sense. It's still looking backwards. And what we actually need in terms of, you know, my biggest barrier is effectively that we are unable to think out of that scenario at the moment, and it seems to be very, very rule-based. If we move to a more of a performance scenario, then, in matter of fact, we have range to innovate and actually create a lot more efficient buildings overall.
How about you, Simon? I know you've touched on a few barriers.
Yeah, I mean, just doubling down on Asif's point first, I think, you know, we're talking about all this because there's a planetary climate and ecological crises happening. So we're concerned about stopping, reversing, and rebuilding those. So we care about the outcome, not how we get there so much. So I think set the end point you want organizations, buildings to do, and then the market will innovate, and that's what it's brilliant at. So tell it where it needs to get to, and give it the elbow room to do that. I think the other big barrier I've touched on, you know, is the short-term political cycle that we operate within, and the impact that has on regulatory behaviors and financial investment behaviors, and I think that's incredibly damaging and it's really hard to get through. I think this sort of siloization of different environmental imperatives are really problematic as well. So, you know, best practice organizations like everyone on the panel and in the room are brilliant at thinking about low embodied carbon and, you know, really good operational carbon performance and what impacts this building going to have on the local biodiversity and, you know, is it adapted for the future and all that. These organizations are great at that. The mass market industry does not think of the Venn diagram of all those impacts together, and certainly the regulatory frameworks don't think of those things together. So we're constantly battling against a new regulation coming and all the unintended consequences it will bring. So in the UK, there's impending regulation about the standards to which all new homes and new commercial buildings will have to be built for a generation, and it's just focusing on operational carbon. So it's, you know, there are working groups doing great work, I'm sure, on all the other issues, but they're not being embedded in that legislation, which is going to dictate 30 years of building. So, you know, it's that siloization of all these key issues outside the best practice of some of these great companies that really concerns me as the biggest barrier to progress.
Thanks, Simon. How about you, Zainab?
So I'm going to talk from an operator point of view, so a little bit a different view of that. So basically, as an operator, one thing we think about is the cost, right? And so it's also linked to awareness, because when you and in our case it's different because we're also a charitable organization, so we're non-for-profits, and then you're going on to building a super expensive building that is very efficient. Why are you doing this? So it links to both, right? It links to the awareness. Why are people we really need to work on educating the people. We're changing a lot of, introducing a lot of policies, educating the people on why are we doing it now? And then also educating them that yes, you are putting a premium on the construction and the capital cost now, but in the long run, it's actually you're really saving on your OPEX, right? So it's both. So it's the cost at the beginning, the startup cost. We need solutions has to be found. People have to look at areas. How can we save a little bit on this premium? Which, by the way, I researched. It's about 1 to 2% cost increase. It's not that high, but the perception of everyone is, oh, that's super expensive. We're not going to do this now. Why are we doing it? It's not important. So that's why. But you put the measures and the matrix and the calculations and people study. That is very cost saving on the long run.
You know, I think we've touched around design, operations, but I think one piece of this puzzle that we haven't touched on, and Simon, you were just getting there, is that, you know, when we design better performing buildings and we've driven down that operating energy use, the embodied emissions associated with the materials that we construct our buildings out of actually becomes a bigger part of the whole life carbon piece of the puzzle. And so sustainable material procurement, understanding the embodied carbon associated with whether it's concrete, wood flooring, glazing, insulation, we can't forget about it because those emissions are actually released on day one of opening our buildings, where the operations emissions are released on an annual basis over 60, 100 years. And so I'm going to maybe jump to Asif because I know he's got a PhD in embodied carbon.
All right. No pressure.
No pressure. You know, Asif, maybe you could just speak briefly about kind of the opportunities. You know, what are you seeing in this space around embodied carbon, kind of like in terms of what you're doing with your teams from a design perspective?
Right. Okay. This goes
shortly, in a short response.
Short, not a PhD response,
no,
a short response.
We do want to allow room for questions.
Right, okay. In terms of the hospital, and what we've talked about now is effectively about flexibility. Now, in terms of flexibility, bay width becomes a critical key on how flexible your facility is. So for a new facility, we want that wide bay width at a module so that we can actually put in patient rooms at a specific module and they all work. They work to the regulations, you know, sort of like, and you can swap them out at a later stage. So it has that longevity aspect. So we are looking at thinning those columns down, making them super strong, making them prefabricated, using things like spun concrete, strengths of around about C100, which in terms of compressive strength, huge. But they actually reduce the amount of materials, provide the flexibility, and provide those long spans. Yes, it comes at a carbon cost. But, sort of like, you have to sort of like, that is a balance that you have to play. It's not that we are going to be able to make all of our hospitals out of timber and then just forget about the problem. We've got specific specification issues that we have to deal with. So it's sort of like, it's that delicate balance of doing the right thing and making sure it's still fit for the future.
Right. Now, Andrew, what are you seeing in the Saudi market in terms of kind of changes in construction materials?
Well, so I think that there's it's recognised amongst the PIF entities and the giga projects within the kingdom that there's so much construction that they're going to have to invest in their own supply chains. I mean, NEOM has just placed or is placing the largest order for steel in human history. There are insufficient suppliers globally to meet the demand within the kingdom. And so they're having to move further upstream within their supply chains. And so that does present an opportunity if someone chooses to seize it, to embed sustainability, not just within their own projects, but within the actual sector itself, the construction materials sector. So that's one of the things. I mean, the second thing is within healthcare is to move away from this building-centric approach that people will come to the hospital, that we need outpatient rooms, that these things will be provided. The medicine's changed immeasurably. I mean, like if you designed an orthopedic centre a decade ago, you'd need 50 beds. Today we do knee surgeries as day case. It's the requirements have changed, and over that time, you'll have built and constructed a hospital that wasn't fit for purpose on opening. So that's got to be the primary consideration with the new projects moving forwards.
Okay. Yeah, Simon, you want to lean in there?
Yeah, just to jump in, so when we did our whole life carbon roadmap for the UK, and that's obviously looking at embodied carbon, construction carbon, and carbon in use. So about 2035 is the tipping point in the UK where embodied carbon becomes the primary impact of our built environment. So as we get more and more efficient buildings, the materiality is the thing that counts. And at the moment, it's unregulated. It's addressed in a voluntary fashion. So that's the UK I'm talking about, but that's pretty much mirrored in many already mature and emerging economies as an issue. So we really rapidly need to be getting to the point where we're better understanding, measuring, reporting, and then limiting this really, really fast.
I echo what Andrew said. It's the supply chain, I think, in the Middle East, or at least where we are from in Egypt. When we looked at all the material that needs to be procured to the project, they were mostly imported. There's nothing within the market, and this also had an extra cost on the overall project. So I think the supply chains, and maybe with Saudi leading the way on this, hopefully within the Middle East, we'll be able to access more of the construction materials that are helpful.
Well, I think there's also a bit of opportunity, responsibility for some of these kind of mega healthcare projects, even around the world. They're big drivers of economy, and how do we wisely spend those dollars and help change kind of the supply and demand for better products from an embodied carbon standpoint. So I think there's a huge opportunity there. Now, I'm going to pause for a minute and see if there's any questions from the audience before I ask for kind of your closing thoughts, because we're getting close to the top of the hour. So any kind of questions from the audience? Yes? Yeah.
No shouting. A lot of the technology in medicine is changing. So, and you've given us examples of, how we went for knee surgery. It used to take us a week. I had one 20 years ago, and I was there for a week versus, a couple of hours now. But I just wondered, the thing you haven't really talked about is the massively aging population and how we cope with that in the health service. And it is really a huge problem. And then just I've been working on on Guy's in London, but also on and St Thomas's separately, and then Central Middlesex Hospital, and we looked at the energy sort of systems and the overheating. Their heating is coming in. It's really old, at about 160 degrees. It's crazy. So we're looking at how to kind of renew that infrastructure and deliver heat. I'll talk about it tomorrow, data centres, but also from the River Thames, as sort of decarbonised models. And I kind of raise it because I think there may be smarter ways of tackling the sort of the energy problems through sort of infrastructure. And they're huge demand, but they also then offer an opportunity for more community-based infrastructure. But I also raise it because it feels to me like a hospital is incredibly complicated. I think you mentioned rightly that we're trying to deliver places that get people healthy quickly. So there's a biophilic, there's views, there's air quality, there's overheating, there's noise, there are so many components. There's very efficient delivery of healthcare, etc. And the carbon is just one small bit. I just wonder, so it's incredibly complicated, and whether there aren't some easy fixes for all of this. So there's a kind of an aging thing, and whether there's some easy fixes for what is a huge industry.
Andrew.
Yeah, I'm not sure I'm willing to take on the ageing thing. Successive governments have failed. We've talked about integrated health and social care for decades, right? I mean, this is not a problem that people are unaware of, and successive governments have chosen not to address it. We will always need an acute healthcare setting. That's not debatable. I mean, we will need trauma centres, we will need majors, we will need surgery, we will need. But there are things that we can provide for an ageing population out of hospital, in environments that are better suited to those particular conditions. But I don't know that there is a solution to the ageing population with increasing comorbidities. We know that people with 2 or more comorbidities account for more than 50% of the healthcare budget. I mean, we should be talking about preventing diabetes as opposed to treating it. But that's a much, much bigger sort of problem to solve than I think we're going to solve this afternoon.
That's beyond the scope of our panel.
Yeah, 55 minutes wasn't sufficient.
Any other questions from the floor? Oh.
Sorry, just on Dan's point there as well, though. I think I go back to the point about different countries have different experiences and have very different social setups. And if we think in the UK context, we're really bad at designing and delivering multi-generational living capabilities for our families and communities, whereas lots of places around the world are eminently good at this, at understanding how that works. So I think there's part of that sort of knowledge exchange piece for us. I mean, as UK GBC, we did a report, it's probably going back to 2017 now, around health in homes, and we actually did a section within that around multi-generational living and that co-care piece. And I think it's about really investigating and understanding all those models and what's working outside the UK, because certainly if I dwell back on our national picture on it, we're in pretty bad shape on that.
I'm going to go from something macro and big and challenging to answer to something quite micro. So, I mean, obviously another component of a hospital is the medical equipment inside it. So just speak to some of the trends that you've witnessed in terms of what the OEMs are doing.
I think, like Andrew said, a lot of companies now are going to more digitizing a lot of the services, especially with like pacemakers. And I think on the heart and cardiovascular side, there's pacemakers, there's a lot of the echocardiograms, there's a lot of things that are now either very, very small equipment or wearables or that are not very energy, not as big as a big equipment as an echogram that would indeed need lots of energy. So I think there's a lot of changes and trends and technologies that are coming in place, and I assume in the next 5 to 10 years we're going to see a lot of changes, including to the big equipment like CTs and MRIs, and I'm sure they're going to come up with other sources of energy, and because they are very energy intensive.
to that point, the pacemaker one's a really, really good example. So Medtronic have been running a pilot in Manchester, and they've gone from outpatient clinics where everyone's invited at a given time interval and have a diagnostic, but it doesn't tell you anything. What you need is the data off the pacemaker to know when someone's deteriorating. And they've gone from clinics of 100 people to now nurse-led virtual clinics run on their own where they can get through 100 patients in 45 minutes because they're only looking for the ones that the pacemaker has alerted them that they're deteriorating. And that completely shifts the way that you would think about planning a space. I mean, like, you looked at clinical briefs in 2018 and they had 200 outpatient rooms. And Q1 2019, how many people went to a hospital? It requires a totally different way of thinking about the provision of healthcare.
Well, I think we're kind of coming to the end of our kind of afternoon session here, unless there's a burning question at the back. Peter.
Thank you. Great discussion, guys. I've learned a lot, so thank you very much for that. Quick one, coming from an energy perspective. This is our hospitals are a piece of critical infrastructure, and obviously they need to have power all the time. That needs to be resilient. How do you decarbonize backup power systems? They normally rely on diesel, not particularly nice. Any thoughts on that?
Oh, is this me? Or? Oh, right. Okay. We're not there yet. Quite honestly, we're on a journey, but there is possibilities in terms of hydrogen to actually have hydrogen storage on site. So that would be the ideal, and there needs to be a pathway. I think we're at COP at the moment, and everything is something towards something. But as a matter of fact, we can't block the future transition paths. So yes, Leeds Hospital will probably have a diesel backup generator, but there's no reason why that couldn't be swapped out for a fuel cell and be hydrogen in the future. Realistically, batteries will not cut it. You will not be able to get enough battery power in there to actually do that, but you still need to plan for that future pathway to make sure that you can retrofit in the future. Your own building, 20 years on.
Just want to say, like, as we said, when we were retrofitting our existing hospital, we realized, okay, we do consume a lot of diesel. What are we going to do? We're in a very, very sunny city in Aswan in the south of Egypt. What are we going to do? Just put solar heaters on top. And we did reduce our diesel consumption quite significantly, just putting some solar heaters on the roof. But we have this because we live in Egypt and in a sunny city, but I'm hoping that there are a lot of solutions in the future, like you said, with the hydrogen that can really help reducing the use of diesel.
Okay, Simon.
I obviously get the fact that we're not going to be able to put mega batteries in to sort of fix the resilience needed on the backup power, but I do think there's a wider general point around, again, think about the UK, our electricity grid infrastructure is creaking, and actually what we need is a much more flexible energy system where we're beginning to plug the built environment in as effectively nodes on the end of the grid itself, putting much better storage capacity into a much wider range of built environment. We've been working with National Grid and future energy scenarios, looking at what that could look like. The joy of it is, if those conversations and that logic develops, all of a sudden you're tapping into national infrastructure spend, you're not tapping into built environment spend, so you're moving from tens or hundreds of millions to billions of pounds you can come in. So, that I think is part of the long game about getting the built environment as plugging in as battery nodes at the end of the grid. If we think of alveoli in the lungs, they become the sort of batteries everywhere. Then I think we begin to add resilience, which could maybe, address some of the sort of power capacity side on the bigger infrastructure like the healthcare sector.
So I think we're kind of at time. So maybe we can just have a quick kind of closing thought from each of you. And I'm going to start with Andrew, moving the mic back towards myself. But, just kind of last thought that you want to leave the audience with in terms of a kind of a takeaway from today's conversation or from your experience at COP so far?
I just think the next decade presents just an enormous opportunity with Vision 2030 and the projects that are underway. And the KSA has this enormous opportunity to change sustainability, not just within the country, but globally, given the scale at which it's operating. And that will influence healthcare and every other sector.
We're, sort of like we're designing long-term assets, and we shouldn't block off what we can do in the future. So, in matter of fact, sort of like we need something that is upgradable, modular, thinking more about the circular economy and being able to swap out features when we need them and when we don't.
Not to steal the metaphor from Antonio Gutierrez, but we've entered the era of global boiling. We've got to accelerate the pace at which we act, and we don't know what all the solutions are, and we've got to be less afraid about trialing things, going out. If we fail, we pivot, we learn, and we move on, and we quite often learn a lot more from the things we fail at in this space than we do from the things that work. So I think we just need to accelerate and be much braver and prepared to fail at some of these things. And the other thing I just say is to go back to if I use the African continent example, 80% of this stuff isn't yet being built. So getting that new build right and helping, other continents and emerging economies as much as we can is going to be an imperative. I think 70% of the global population increase up to 2050 will be in African cities. So we need to help address those challenges.
Like I said, promoting patient health should be done within a healthy environment. And to touch on what Simon said, we are based in Africa, and I'm very proud to say that we are leading. We are the only LEED Gold hospital in Egypt and in Africa, and then we are leading the world, leading Africa towards building sustainable buildings and healthcare infrastructure. So I hope that with our example, it can be done, and it's very much doable and can have a great impact.
Thank you, everyone. I just want to first thank you for all of your leadership in your various market sectors or regions around the world. I think without your advocacy, design work, and really commitment to proving out solutions in the healthcare marketplace, I think it's notable, and it's the change that we require to see if we're going to meet our 2030 and 2050 climate objectives. And thank you to everyone in the room this afternoon for coming and joining us for this conversation, and thanks for engaging with some great questions to the panel. So thank you, and we'll see you around COP.